So Dr. Norton and I do have different personalities and different ideas on things, but that really just strengthens our resolve towards building a great team here at FSA. And so the way it kind of started was we centered the entire idea of the practice really around the patient, and we both wanted to have a practice where the patients came first. And that really just strengthened our relationship. Even though our personalities are very different, we were able to really just build an entire team to make sure that patients come first. And that's really what strengthened our relationship and brought us into partnership together. The thing that makes our practice different is really the comprehensive nature of it. And so that's what a lot of other people are not able to offer. A lot of other spine clinics do not have the same level of focus on simply spine care. So we've brought in the best pain management doctors, spine surgeons, physical therapists, an entire ancillary team to make sure that the patient's supported. So once someone comes into our network and we're able to bring the patient in, evaluate them, determine what's wrong and how to help them, we're able to offer a higher level of care. And we're also able to communicate with each other. So it's more of a teams-based approach. You're going to have a pain management doctor and an orthopedic spine surgeon discussing your case very frequently. So we're making sure that the patients are receiving the highest level of treatment and they're being looked at by more than just the physician they're even seeing that day. So the patient response to our comprehensive practice has been great. We're growing and more doctors are coming onto the practice. The patients have been with us for a long time now. I have many patients that have been my patients for 7 years or so, and we've become friends. We know each other's family members, and it's been a great response. So you get to know a person a lot better that way, and so you're not just providing, basic or superficial level care. You really know what's going on in their life, and when that's the case, you're able to provide them with better treatment. So I think one of the things that's most surprising about knowing your patients really well is knowing that you don't have to overtreat them, right? You really want to get to the patient's goals and not your own. You may see a particular finding on an MRI or see something that is very severe, but it doesn't bother the patient that much. And so knowing them and knowing that, you know that it doesn't require intervention or surgery to really fix the patient's problem. You just need to get them to the level where they want to be. So for example, if someone just wants to be able to stand and be able to cook and clean a little bit longer, that patient really can get by with some more simple treatment sometimes, versus the person who wants to get back to a very active lifestyle or playing tennis or golfing again. Those patients may require more intervention, and you have to make sure that you're meeting their goals, not just your own. Building a relationship with a patient is certainly something that's very challenging. When you first enter the room, that's a big part of it. First impressions are really something that lasts for a long time. So I try to make sure that I'm really discussing with the patient what's going on in their lives, how their back pain or neck pain is really affecting them, and what their goals are. So that way I know the things that they want to get back to. That really helps them to make sure that they're guiding the treatment. The patient's helping us to decide the right things for them to have, so that way we can get the patients back to their normal lives.